Welcome to our presentation on the parasympathetic nervous system, a motor division of the autonomic nervous system. The parasympathetic nervous system arises from the central nervous system, particularly at the craniosacral region. So basically, the neurons of the parasympathetic nervous system originates at the brainstem and the sacral spinal cord. Just like the sympathetic nervous system, it also is a two-neuron system. So we have here our preganglionic and the postganglionic neuron, and this is a spinal cord. This is a CNS, and we have here our preganglionic neuron, a ganglion, and the postganglionic neuron, and these are the effector organs. This is another diagram of the parasympathetic nervous system. So again, the neurons of the parasympathetic nervous system arises from the brainstem and the spinal cord. So that is why it is also known as the craniosacral outflow or the craniosacral system. It has two neurons, the preganglionic and the postganglionic neuron. And as you can see here, the preganglionic neuron is longer. It has a longer preganglionic neuron compared to the postganglionic neuron, so that the ganglia of the parasympathetic nervous system is near the effector organ. We have four cranial nerves now that arises from the brainstem. You have the cranial nerve number 3, cranial nerve number 7, 9, and 10. These are the sacral spinal nerves that also has a parasympathetic function. For its innervation in the pupil of the eye, it induces meiosis or the constriction of the pupil. For the salivary gland, so it has a stimulatory effect on the salivary flow. It produces a watery saliva. It has an enzyme-rich saliva. For the bronchi of the lungs, or the bronchioles of the lungs, it induces bronchoconstriction. So of course, this is important because during rest and digest, the lungs tends to, particularly the bronchi tends to constrict in order to prevent the entry of foreign bodies in the lungs. Because dilation of the bronchioles will attract the foreign bodies to enter the lungs. For the heart rate, of course, for the heart rate, there is a decrease in the heart rate or bradycardia as seen in the rest and digest event. For the digestion, so there is a simulation of the digestion. There is a simulation of the movement of the ingesta along the intestines. So there is an increase in the peristalsis. And for the urination, it also induces increase in the urine output or increase in, there is also urination during the parasympathetic innervation. These are the nerve with parasympathetic function. We have the cranial nerve number 3 or the oculomotor, which innervates the eyes. The facial nerve, cranial nerve number 7, and the cranial nerve number 9 or the glossopharyngeal nerve, which innervates the face, particularly the glands of the face. We also have the vagus nerve, which innervates the viscera in the chest and the abdomen, and the pelvic splanchnic nerves, which innervates the organs in the pelvis. So this diagram shows the site of origin of the preganglionic neurons in the CNS system for both the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system is on the left and the parasympathetic nervous system is on the right. The sympathetic nervous system is also known as the thoracolumbar system or thoracolumbar outflow because the preganglionic neurons arises from the thoracic and the lumbar vertebrae, particularly at the T1 to L2 or L3. So these are the innervations of the different of these sympathetic nervous system. So it has a preganglionic neuron, and it also has this postganglionic neuron that innervates the organs, different organs having an involuntary function. So as you can see here, the preganglionic neuron of the sympathetic nervous system is shorter, so that the sympathetic ganglia or the paravertebral ganglia is near the vertebrae. For the parasympathetic nervous system, it is also known as the craniosacral outflow or the craniosacral system because the nerves arises from the brain, the brainstem, and the sacral region of the spinal cord. For the Cranial nerves with parasympathetic function. This includes the cranial nerve number 3, so it innervates the eyes. Facial nerve, which innervates for example, the lacrimal gland and the salivary gland. We also have the glossopharyngeal, which also innervates these salivary and the lacrimal. We also have the vagus nerve. So as you can see here, the vagus nerve is very extensive because it innervates the viscera along the chest now and the abdomen. So it is considered to be the most extensive cranial nerve that has a parasympathetic function. We also have the sacrospinal nerve, which innervates the intestine. We also have the bladder, the urinary bladder, and the reproductive organs. The parasympathetic nervous system comprises all the responses that occur when the body is at rest and is commonly referred to as the rest and digest state. It ramps up all the bodily functions that are not necessary for immediate survival, while downregulating or normalizing all the actions that are critical for survival. So, therefore, activation of the parasympathetic nervous system results in increased, so there is an upward arrow here that means increased in salivation, lacrimation, digestion, defecation, and urination. So these are considered to be non-critical actions for survival. And these are upregulated by the parasympathetic nervous system. On the other hand, it downregulates the critical actions for survival. So it downregulates or it decreases the heart rate. So that is known as bradycardia. It decreases the cardiac output, and it also decreases uh, the function of the bronchioles. So there is a constriction, no, constriction of the bronchioles, and meiosis or a constriction of the pupil.